And welcome to this week's mini mental health training. We're going to be talking about excited delirium. Well, this is not necessarily a mental illness, it does have similar features and is something to watch out for. I'll define excited delirium, list the signs and symptoms, discuss communication strategies, and what to do when you come across someone who is in excited delirium. First, what is excited delirium? It's a state of extreme mental and physiological excitement characterized by extreme agitation, hypothermia, hostility, exceptional strength, and endurance without fatigue. When people think of excited delirium, it is for example, the person, I believe it was in Florida, that was on bath salts and was eating other people's faces. That is an example of excited delirium. If you go on Google and type in excited delirium and look at the videos, there are a lot that come up. But these people usually have extreme strength, they're extremely hostile, and have a lot of agitation, and is something to look out for. What causes excited delirium? Excited delirium is caused by synthetic drugs such as bath salts. They produce a physical effect of the central nervous system, stimulants, hallucinations, and dissociative anesthetics, often combined with amphetamines and manufactured synthetic drugs, results in violent and psychotic behavior in some people. Recognition is crucial because it is a public safety emergency, officer safety emergency, and a medical emergency. This person can be a danger to themselves and others around them, and EMS should be called because cardiac arrest and death is possible along with other medical complications. Recognizing excited delirium in someone is very important. It sometimes can look like psychosis. It's important to recognize it as excited delirium so that they can seek medical attention. Excited delirium, like I said, can look similar to mental illness and psychosis. Again, recognizing excited delirium is important because it could be a safety and medical emergency. Excited delirium, how to recognize it and some symptoms, and it causes extreme excitement and disorientation. Somebody may repeat phrases incoherently, possibly have delusions and hallucinations, elevated heart rate, blood pressure, and body temperature, acting in an erratic manner, including the removal of clothes. Because their body temperature goes up, people in excited delirium tend to remove all their clothes in order to try to cool themselves down. They have a very high threshold for pain. Things that would work for normal people to stop them may not work for someone in excited delirium because they have a higher threshold for pain. They also have increased strength, endurance, and aggression, which makes them very dangerous. Intense physical activity may result in unanticipated medical complications. So not only does excited delirium itself have medical complications, but if somebody is fighting or doing something to hurt themselves, it could result in unanticipated medical complications, which is why it's important to have EM standby. Communication may be difficult for someone in excited delirium. Here are some techniques that you can try. Recognize that the individual may be suffering from delusions and paranoia, and your presence there may be an agitation to them. Patrol vehicle lighting should be minimized as much as you can. People with excited delirium tend to go towards shiny things and lights. And if the patrol vehicle has its lighting on, it could agitate the person further. Keep a safe distance until it's time to take the subject into custody. This way, if they come at you or start to get aggressive, if you're at a safe distance, it'll help you stay safe. Keep your hands visible at all times. Again, it kind of goes along with that paranoia and delusions. They may notice if your hands aren't visible and may start to escalate. Authoritative commands and loud voices may not be as effective and may actually have an adverse effect for somebody. Instead of authoritative or commanding tone, it may help to use the low and slow approach. Communicate with the subject in a calm manner. Speak directly and slowly. Lower the pitch of your voice and slow your movements. And this can go with anyone who is in agitated state or elevated. The more calm and relaxed and slow you are, the more likely the person that you're with is going to slow down. When responding to someone who may be in excited delirium, it is important to keep in mind some things. If possible, await for backup. Research has shown that it may take 3-4 officers to take a subject into custody who's in this condition. Do not try to take this person on yourself. EMS should be alerted immediately and staged if you feel like somebody is in a state of excited delirium, because they may be having medical complications or may start to have medical complications while you're there. Although these subjects may be experiencing a medical crisis, all of your prior training, policies, procedures, and guidelines remain in effect. Every effort must be made to preserve the safety of the officers involved and also the public. And even though it is a medical crisis and the person is, it's a medical emergency, you still need to treat it and make sure that you stay safe and the public stays safe and the person stays safe as much as possible. Thank you for joining us this week. If you have any questions or have any concerns, feel free to contact me. Thank you and have a great weekend.